Good morning from WKYT News. I'm Bill Bryant, and we welcome you to Kentucky Newsmakers and certainly hope that you're enjoying your weekend. The state's COVID-19 numbers have been spiking again. Doctors say it is mainly due to the rapid spread of the Delta variant and Kentucky's large number of unvaccinated residents. More about that later when we're joined by Public Health Commissioner Dr. Stephen Stack. But first, summer is flying by for students and families enjoying a break and for schools preparing for a new year ahead that is uncertain at best. The renewed COVID concerns are leading to major decisions for school systems about masking and social distancing and whether they need to keep online options at the ready. A third-generation Kentucky educator who started his career in Hazard, Kentucky, Education Commissioner Dr. Jason Glass returned to his native state at the height of the pandemic last year after overseeing schools in Iowa and being a superintendent in the Denver area. Commissioner Glass joining us today for Kentucky Newsmakers. Thanks for being here. We appreciate it, Commissioner.
Thank you, Bill. It's great to be with you again.
How concerned are you about what we're seeing now as a surge in COVID numbers here in midsummer as we head toward the start of the school year? Some counties have returned to the orange and even red zones in these weeks leading up to the beginning of classes.
Well, I think we all knew that this would not go away easily, and while our hopes may have been that with vaccinations becoming available and summer getting here that we would be through this, and I think we have come through the worst of it. We've still got to be careful a little while longer, and that includes our schools and what that means for the startup of school this fall. So we've got some more work to do. We've got new guidance from our State Department of Health and from the CDC around how we can keep schools safe, and so we're going to follow those, but I think we can look forward to more normal than it was before, but we're not out of the woods yet.
You have said that masking should follow CDC guidelines, but is ultimately a local decision about whether students and teachers are required to mask up, especially if they're unvaccinated. You are basically just giving your guidance, your opinion, and then it's up to the local schools?
Well, we've been unambiguous at KDE and from my office that we follow the science and follow what health experts recommend that we do to mitigate the spread of this virus. And our schools have shown that if they follow those mitigation steps, they can keep schools from being vectors by which COVID-19 spreads in communities. So we've seen that be effective. So continuing forward, there's no reason on earth that we would deviate from that path. The latest CDC guidance that our State Department of Health guidance mirrors indicates that masks should be worn for unvaccinated individuals. And at this point, that includes all students under 12 because we don't have a vaccine that's approved for them. So going into the fall, our strong recommendation is that they follow that CDC guidance around masking, around 3 feet social distancing, which is an improvement over 6 feet. So now that gets us out of the hybrid schedules and not being able to fit everyone in classrooms. That's an improvement. And that schools continue with the hand washing procedures, hygiene procedures, increased ventilation, contact tracing, quarantining, all those things that were effective last year. We're going to have to continue that a little while longer. But I think the good news, Bill, is that we're looking at in-person start across the state. Districts can decide to ignore that guidance if they want to. I don't have any authority to tell them to do X, Y, or Z when it comes to their health procedures, but they do have liability risks. If there were to have an outbreak and someone were to get ill or worse because of the decisions that the school makes, there's some liability involved. So they need to consider that when they're making their determinations locally.
Do you anticipate that local school boards and superintendents and others will be under a lot of public pressure from both sides on this as they arrive at the decisions about how to move forward on masking, for example?
Oh, absolutely. There's certainly no shortage of opinions on what should be done when it comes to school or society when it comes to managing COVID. We come back to what does the science indicate and what does the evidence prove? And we've shown that by following some virus mitigation strategies that are based in science, we can control COVID-19 in schools. We can have in-person instruction. So that's the good news. But we can't just pretend that this virus doesn't exist, as frustrated as we are with it. Our enemy is this virus, and it doesn't rest, it doesn't get frustrated, it doesn't get fatigued, it just waits for openings and waits for us to let our guard down, and we can't do that with our schools and our kids. So my strong recommendation is that schools follow the CDC guidance, follow our State Department of Health guidance, and stand by that. We know that we're not going to make everybody happy, and we're not going to find consensus on this issue. But if we base our decisions in science and in what's proven effective, that's a pretty strong place to stand.
Commissioner, how nimble do you think schools should prepare to be if the numbers continue to climb? If we have hot spots that break out in certain areas of the state, do they need to be ready to move quickly to virtual options?
Well, I think one of the things that we've learned throughout this whole year of managing this pandemic in education is that we don't know what the future is going to bring. When this first started, I don't think any of us could have wrapped our heads around that over a year later we'd still be wrestling with it and tangling with it. And it seems like every few weeks there's a new development and something changes. So I'm hesitant to look into the future and say, here's what's going to happen. I think we have to keep monitoring the situation. We have to remain aware. We have to remain data informed, and we have to adapt our own behavior and our own tactics as far as managing the virus going forward. I sure hope that we don't end up having to switch to all virtual options again. Even the CDC guidelines that have recently come out indicate the importance of in-person instruction. We know the negative effect that had on so many of our kids. Some of our kids thrived in a virtual environment, but a lot of our kids missed out on experiences that our schools are now working to make up for. So I hope we don't have to switch to that, but we have to remain open, remain flexible, and watch the data and then make decisions based on evidence.
What is your feeling about whether schools should offer both in-person and a virtual offering? I know Scott County reversed its decision this week. They were going to have a virtual option. They've decided to go all in person. There may be others that arrive at that decision. What would your guidance be on that?
Well, whether COVID exists or not, I'm always a proponent for thinking about education delivery systems that best meet the needs of the students. So that could be virtual, in-person, hybrid, and all sorts of school models that may exist out there, to where we offer a variety of different learning options that fit the needs of students. In this case, I wasn't in the discussions with Scott County. That's a completely local decision, so I trust that they are doing what's best for them and their community, and I hope that decision works well for them. So I support that local determination. My recommendation for school districts is to think about a variety of different educational options from an instructional standpoint, but especially as we know that we may have more disruption because of COVID, to also consider how you could have virtual options or be able to switch to a virtual option if the need presents itself. We hope we don't get to that case, and again, we've, I think, proven that we can manage COVID-19 with mitigation efforts within schools, but widespread and exponential community transmission is a threat to school operations, because the more the virus is prevalent in the community, the increase of that risk for students and for staff in schools. The best thing that we can do, the most effective thing that we can do, is move toward full vaccination as quickly as we can. That includes our students, our staff members, and our community members. So I can't stress enough, the best protection that we've got is vaccination.
Given all the challenges out there, you have talked about returning to what you have called a better than normal scenario for schools. What do you mean by that?
Well, we learned a lot through this past year about what we miss about in-person instruction, the relationships that we can create between teachers and students, and the outreach into communities, the relationships between students. When we have to shift to all virtual, we lose a lot of that. So we really learned how important that was. We also learned that we can do some things with technology that if we hadn't gone through this, we wouldn't have been aware of, like the hybrid option, like the virtual options that schools have gotten really good at over this past year. And using those less synchronous, or all the students learning in the same way together, less of that, and allowing our students to be more independent, to work on individual projects, to present evidence that they've mastered concepts in their own ways. All of these are positive changes that I think we've learned, and the flexibility that our students had in school, outside of school, to when and how to learn, how to show that they've mastered concepts. I hope that those are things that flow through and continue with us, because we really have learned a lot about flexible delivery models and options for students, that there's a variety of ways that students can and should be learning inside and outside of school, and we hope that those continue and stick with us going forward.
Commissioner Glass, you know this is a culturally divisive time in America, and that has led to heated discussions about curriculum. A hearing this summer in Frankfurt came to be focused on critical race theory, as there's a move to ban that from being taught in the Commonwealth. What should the public know about your stance on how history is taught?
Well, I'm certainly no expert on critical race theory, and it's not something that I use on a daily basis. So that might be something, if you want to learn more about it, to have someone that's an expert in it and a user of it. But anytime we start talking about banning things and censoring things, it gets me concerned. I don't think that's in line with our values as Americans. We don't run from tough discussions and tough debates. We bring ideas out into the open and talk about them, and have a free market and exchange of ideas and decide what the best path is forward. That's important for our citizens. It's important for our students as they grow up to be citizens. And so I think we need to be cautious when we think about banning or censoring speech or thinking. That those are tools of autocratic and some of the worst tyrannical regimes in history. So I think we just need to be thoughtful and careful as we move down that. And I think curricular decisions are largely, in Kentucky, historically have been an element of local decision making. So if our lawmakers are thinking about a ban that comes from the State House, that's going to violate some values that they have around local control and some values that we have as Americans around the free exchange of ideas. And they need to think carefully about those two steps as they consider this proposition.
What can parents do right now in these weeks leading up to the start of the school year to be sure that kids are resilient and ready to go? I mean, is it as simple as maybe get some bedtimes in practice and that kind of thing, and get ready to begin to hit the books again?
Well, our schools have operated summer programs. We got a large infusion of federal dollars to help recover from COVID-19. We're going to be able to spend that over the next 3 years. And so school districts all over the state, you've seen a variety of different summer programming options, some early return to school options. We're going to see expanded supports when school gets going, after school programs, Saturday school programs and weekend programs, and lots more people that are supporting our kids. So all of those are things that are really positive. I think if we look back on this time, we're going to look back on this year that we've had, and our kids are going to say, wow, that was a really terrible. All of us will say that about the experience we've had with COVID-19. But looking forward for our students, we're going to be able to create some amazing experiences for them and put some supports around them that they never would have had otherwise. So I hope at 3 years from now, our kids will be able to look back and say, you know, that year of COVID was really terrible, but what my community, what my school, what my parents did for me in the 3 years after that, those are the 3 best years of my life. So I hope that's where we can get to and what we need to work toward. As far as parents, love on your kids, take care of them, make sure that they're well fed, they're getting plenty of sleep, and keep reading with them, keep thinking with them, and keep creating learning experiences in these last few weeks of summer that we've got left. We've got great state parks in Kentucky. We've got great community events happening. We've got great natural resources and outdoor experiences to be had in our state. So get your kids out and have those. Before we get back into school, where there's going to be a variety of different supports in place that I think is going to make this a great year coming up.
Education Commissioner Glass, thank you very much. We appreciate you being with us.
Thank you, Bill.
And we hope you'll stay with us here. We'll be right back with Kentucky's Health Commissioner, Dr. Stephen Stack. He'll update us on the situation out there with COVID-19 and the variant going around. Welcome back to Kentucky Newsmakers. Good to have you with us. And just when we all started to think COVID was somewhat in the rearview mirror, the numbers are climbing again. It's happening as the new school year approaches, and Kentuckians are making plans to attend big events like music and fall festivals and try to return to some sense of normal. So how should we proceed? Dr. Stephen Stack is Kentucky's Commissioner of Public Health. He joins us now with the latest information. Thanks for coming in, Dr.
Morning,
Stack.
Bill.
Really
nice
appreciate
to see
it. As you know, people are ready for this to be over, and had felt like maybe it was. Now the numbers are rising again. What does that tell us?
Well, that the disease is still there. So like the governor said on June 11th, the crisis may have passed in its immediate form, but that the pandemic is still underway. And so we've got to be careful. There's a new variant out. It's much more easily spread. People who are unvaccinated are particularly high risk. And so we've got to be careful. But we do have to move on with our lives. And I think if we're thoughtful about it, we can move on with our lives.
We've had some counties that have slipped into the red category again, meaning the infection rates are high in those areas. What do they have anything in common?
The low vaccination rates generally. And so yesterday at the press conference, I said at 4 o'clock there were 10 red counties. And we updated the map after the press conference, and now there's 13. It's changing quickly. There were no red counties on July 1st. And so when we look at the map, the areas where the vaccination rates tend to be lower are the areas where the cases are climbing the fastest. If you're unvaccinated, you're taking a risk, and that risk is not insubstantial.
Is it correct if, for instance, the president and some other health officials have said that this, at this point, is a pandemic of the unvaccinated?
That's correct. I think it is. This is a vaccine manageable problem now. And while not 100% of deaths are preventable, at this point, every death in an unvaccinated person should be considered a preventable death. And so that's a tragedy when we have a tool that makes those deaths unnecessary, and they're still occurring as people choose to not be vaccinated.
So it's the Delta variant that has us concerned right now. It is responsible for a huge number of the cases, right?
So on May 22nd, the week ending May 22nd, only about 3% of all the variants in the United States were Delta. As I sit here today, it's over 83%. In about 2 months, the Delta variant has crowded out nearly every other type of coronavirus in the United States. So it is the problem at the moment.
Do we have to worry that other mutations will continue to come along?
We do. As long as we have a large number of unvaccinated persons, we have to be very concerned that the virus will mutate. The more people it can infect, the more it can change, and the more as it changes, it can learn how to be more potent, more effective. So it is absolutely important and critical that we get people vaccinated. Worldwide, we probably only have about 1.4 billion people on the planet vaccinated, and there's 7.8 billion. In the Commonwealth of Kentucky, we have about 51%, meaning about half the state's vaccinated, half's not. The 2.2 million who are unvaccinated are both taking a high risk for themselves and giving the virus lots of opportunity to learn, to improve itself, and to be more dangerous.
As long as it's anywhere in the world, it is a threat, right?
That's correct, but this is a pure numbers game. This is the more opportunity for multiplication and transmission, the more probability it will change. So this is a large numbers game. So if we vaccinate large numbers of people, there's not going to be large numbers of people to infect and for it to mutate in.
Are we seeing, as the number of cases is going up, are we beginning to see the numbers who are being agreeable to vaccination go up as well?
I would say we have a continued slow interest in new people getting vaccinated. I would not say that we've seen any major uptick specifically because of the Delta variant yet. Now our hospitalizations are beginning to increase. And so as those increase, what follows after that, almost always, are deaths. And unfortunately, I think what we're going to find is when we look back a couple months from now, those deaths, however many they were, are going to be concentrated in communities who are unvaccinated. I hope they'll be receptive to the message of getting vaccinated before that number grows too big.
As hard as the federal, state, and even local governments have worked to try to promote the safety and effectiveness of vaccines, as you say, here we are basically half and half in Kentucky who have been vaccinated. Many are still very hesitant. Many say it has not been long enough, it is unproven, and as you know, those concerns linger. And then there are those who say they do not want the government telling them what to do. What do you say
on the last part? It's your choice. In the Commonwealth of Kentucky, no one has told you from the government that you must be vaccinated. So first off, when that's portrayed, that's not correct as far as in Kentucky. We have said it's your choice, and we're consistent in that. As far as worldwide, we have vaccinated, as I just said, almost 1.4 billion people in less than 7 months. These vaccines are safe. And it is a tragedy when people on social media and in other outlets communicate messages that falsely equate normal occurrences, people naturally dying, people naturally having rare events, with somehow a lack of safety. That is a falsehood, pure and simple. The vaccines have never been deployed at this scale, at this pace, for any other condition before, And in 1.4 billion people worldwide almost, we can say without hesitation the vaccines are safe. It doesn't mean there aren't rare occasional problems, but your risk, your relative risk of getting hurt by the virus is many, many-fold higher. So in a world full of risks, the safest course is to choose to get vaccinated.
As the school year approaches very quickly and summer is flying by, parents and students and teachers certainly know that. What advice do you have for schools as these decisions are being made? Dr. Glass weighed in on this in an earlier segment, and he raised questions about liability for schools.
Well, the first thing, it's absolutely critical that we get kids back in school and in-person learning. It's so important for their development, their learning, for food and nutrition services, social services, and many other benefits of schooling. So we need to get kids in school, and in order to do that safely, we need everyone who's 12 and older to get vaccinated. If they're vaccinated, they don't have to quarantine if they're exposed, and their risk of any serious harm is diminishingly small. We also need to have people wear masks who don't have the chance to be vaccinated yet. So the CDC has recommended all students under 12 who haven't had the chance to be vaccinated should wear masks. The American Academy of Pediatrics this past week has also recommended all persons in schools should wear masks. We need to make sure the virus doesn't get into the schools. And also this past year, the common cold, pink eye, influenza, we shut it all down. So clearly the masks work. If wearing a mask in the school setting is what it takes to keep kids and teachers and faculty in school safely and without disease, it is a small price to pay to have everyone healthy and safe. And so we'd encourage people to follow the CDC guidance.
What about for others right now? What is the guidance right now for vaccinated or unvaccinated people who are in public settings?
Right, so if you're outdoors and you just have a little bit of space between each other, you're doing pretty good. I mean, we know that the outdoors are particularly a lot safer. If you're gonna go indoors, if you are unvaccinated, you should wear a mask. Your risk of getting or giving the disease is very high. If you have a vulnerable medical condition or your immune system is compromised, even if you're vaccinated, you should either wear a mask or you should avoid settings where you're close to people who are unvaccinated. People can get on with their lives overwhelmingly. We just have to take some extra measure of caution to keep the virus from hurting us too badly.
Some big events are scheduled, music festivals, Railbird here in Lexington, some of the other events are coming up. We know football season is around the corner, the state fair. How do people go about making a decision about whether to attend those things?
Well, again, if you're a generally healthy person who's vaccinated in an outdoor setting, I think you can go ahead and do a lot of those activities. You just have to be cautious in the settings when people pack in the concession area. People are having their third or their fourth beer and they're talking loud and shouting over the noise of the crowd. Those are the areas where you're likely to spread things. But when you're outside and spread out in an outdoor venue, you can go ahead and do a lot of those activities. But again, if you are medically vulnerable, if you have a compromised immune system, even if you're vaccinated, and definitely if you're unvaccinated, you should be very careful. This is not a good time to be out in public and get sick with COVID-19.
Governor Beshear would not rule out the possibility of returning to some restrictions if the numbers were to dictate that. Is that your advice?
Well, I think the governor said a number of things. First of all, it has been and remains a privilege to serve with the governor. The governor's taken hard choices and made hard decisions to keep Kentuckians safe, decisions that were difficult to make and ones that are clearly not popular at times. And so I'm very grateful to have a partner and a boss that supports what we need to do. But he also said the calculus will be very different. This is different than last year. People who wanted to protect themselves had no way to protect themselves unless everyone took steps. Now you have ways to protect yourselves. Get vaccinated, and if you still feel concerned or vulnerable, wear a mask. And for all the rest of us, if someone's wearing a mask, leave them be. They're protecting themselves or someone else. Don't be judgmental. They're making a choice, just like someone else may be making a choice not to be vaccinated. Leave them be and respect their right to make that decision. So now the individual can take steps to protect themselves. So the calculus is very different. So I don't see any immediate return to anything that looked like last year.
Dr. Stack, you stayed with me another couple of minutes. I want to ask you what you would be doing if it weren't, the COVID situation out there. So we'll be back our remaining moments with Kentucky's Commissioner of Public Health, Dr. Stephen Stack, in just a moment. Welcome back to WKYT's Kentucky Newsmakers. Interesting discussions this week, earlier with the Commissioner of Education and now with the Commissioner of Public Health in the state. We'll continue now with Dr. Stephen Stack, who was an emergency room physician dealing with lots of other things when you answered this call to be health commissioner. When you went into this, you had no idea COVID was going to dominate everything. And you had other plans for addressing health concerns in Kentucky. What would you be doing right now?
It was almost like a bait and switch. I signed up for one job and got another, right? Exactly. But so did the whole world, so we're all in this together.
Exactly.
But, we have a lot. The Department for Public Health is an amazing department in Kentucky. And the local health departments and the state health department, the things we do for Kentuckians are really exciting. So we've got work to do to help with early cancer screening and prevention, work to do on diabetes, hypertension, obesity. Tragically, we have an epidemic within a pandemic. We've got substance use disorder and opioid use disorder in the Commonwealth, unfortunately one of the worst in the country. And that epidemic has only inflamed during the pandemic because of many of the things that go with it. So there's so much to do and such a great team doing that work. I would have focused on all of that had there not been COVID. And now I look forward to spending more time on those important areas.
Do you see being able to set your sights on some new goals now, or do we just have to see where this thing goes with COVID?
Well, I have an obligation to try to do all of it, right? And that's the challenge. There's a lot there, but we're gonna do all of that. There have been professionals working on all of this throughout COVID, but the last few months, the summer reprieve a little bit has given the space to immerse in that. We're going to do great work for diabetes prevention programs. We're going to try to work on obesity topics. We're going to work on substance use disorder. We've unfortunately had some increase in HIV in some of the areas of the state. So a lot of those things are areas we'll work on.
Dr. Stack, thank you so much. Appreciate it. And thank you for joining us for this edition of Kentucky Newsmakers. We'll see you this week on WKYT News, and you make it a good week ahead.